Are you someone who has experienced early pregnancy loss? Are you concerned about the possibility of experiencing it again and not receiving the proper care during the first trimester? I'm Dr. Sami Almusawa, a fertility consultant and medical director at Plan Your Baby. Over the past 20 years, I've witnessed many couples endure the pain of miscarriage, which can be distressing and challenging. The most common cause of miscarriage is a chromosome abnormality in the embryo, which unfortunately cannot be addressed. However, there are other treatable factors which I will discuss that could contribute to miscarriage. Progesterone is a crucial hormone for maintaining pregnancy and regulating the immune system. Low levels of progesterone can increase the risk of bleeding and miscarriage, but can be easily treated with supplements in the form of suppositories or injections. Surprisingly, progesterone levels aren't routinely checked during early pregnancy, despite it being a simple and relatively inexpensive blood test. Another treatable cause of miscarriage is an increased tendency to develop blood clots, which can obstruct blood flow to the baby. Blood thinners like aspirin and heparin injections can be used in small doses to help reduce this risk. When there is a baby growing inside the woman's body, it is a foreign object and can trigger her immune system to attack it. Normally, there are mechanisms in place that prevent this from happening, but sometimes they can fail. This can lead to a less favorable environment for the embryo to implant and develop, possibly increasing the risk for a miscarriage to happen, especially in the first trimester. If you have had a miscarriage before, unfortunately the first trimester may no longer be a happy event, as you may experience a lot of anxiety and stress in those first few weeks. At Plan Your Baby, we can monitor you closely and offer you support and medication as required. The first 2 weeks after a positive pregnancy test are critical, as the embryo is very tiny and vulnerable. We offer alternate day testing of hormones like HCG and progesterone via blood tests to assess the pregnancy's progress. While a good rise in HCG indicates progress, it doesn't guarantee a viable pregnancy. With the blood test monitoring, the amount and type of progesterone support may be added or adjusted according to the actual levels to try and achieve a buffer, as progesterone levels can fluctuate. At around 6 weeks into the pregnancy, we will offer the first ultrasound scan to check for the heartbeat, and subsequent monitoring may include weekly or fortnightly ultrasound scans and progesterone tests until the 12-week mark, when screening for chromosome abnormalities can be done. After 12 weeks, the risk of miscarriage decreases significantly, and monitoring and support can be reduced. Throughout the pregnancy, our patients can freely contact us for swift responses to their questions and issues. Prescriptions are sent electronically, and tests and scans can be arranged at one of our partner clinics across the UK. To book a consultation, simply follow the links below.